Well, thank you everyone for joining, and most importantly, thank you for your support and continued support of Genesis Health System, so that we, through your gifts to the foundation and through your engagement, can be as good as we possibly can to care for the community. I'm going to give about a 10-minute update, and then I'll kick it over to Dr. Kopp, who will also speak for around 10 minutes, and then we're going to answer questions either about Genesis or kind of the topic of the day, which is about the pandemic and mental health, or mental health in general. So I'll start off with some things related to the pandemic, and then I'll talk about Genesis in general. I'm going to give you some numbers. You may actually want to write these down. They may make more sense a little bit visually. But so if you look at the community, our community has anywhere, depending on how far you want to go out, 400 to 600,000 people. Well, just Genesis has tested 30,000 of those people. So that's how many tests we've done of mostly symptomatic patients so far. Right around 2,000 of those 30,000 tests have been positive for COVID-19. That's 6%. So 6% of all symptomatic patients have tested positive. That's not a huge percentage. That varies from day to day, and it varies from week to week. It's been as high as 15, almost even reaching 20%, but on average for the whole thing, which is back to March 15th, it's averaged 6%. Of those around 2,000 people, 273 as of last week had been hospitalized. So think about that percentage again. That's right around 15%. So 15% of everybody who has been sick with COVID-19 has been hospitalized. And lastly, then the deaths number, unfortunately, of those 273, 18 have died, and that is also about 6.5%. So of the population, we tested 30,000, 6% of those were positive, 15% of those were hospitalized, and 6% of those were deaths. One of the interesting things about COVID-19 that makes it different than anything else, there's a number of things that make it different, but one of the most interesting is how sick these people are that are very, very sick, because a percentage of those 273 have been hospitalized in the ICU with lengths of stay of 40 and 60 days, which then creates a lot of pressure on the system. So the other thing you may be interested to know is, of those 273 inpatients, how many total inpatients did we have in total in the system over the same time frame? Well, it's 12,000. So this is only 2% of our inpatient business, but it's 2% of the business that gets, a tremendous amount of attention and has changed almost everything in relationship to how we do our business for the other 98%. So I can answer any questions, but that's kind of a general COVID update. Let's talk about, in general, how things are going. One of the things that happened early on is people weren't coming to the hospital, they weren't having their surgeries, they weren't coming to the emergency department. Even after we had ramped back up again, you'll remember early on, in March, we were just kind of assessing. In April, we ramped down and we stopped doing elective surgery. In May, we started to ramp back up again, and by June 1, we were fully ramped up. But since then, it's interesting to note that our emergency department hasn't been as busy as normal. Our surgeries have been busier, but not quite as busy as normal. So right now we're operating about 98% of our normal pre-COVID business. So we're pretty close to being back on track, but not quite there. In an exciting announcement, the board, and we have several board members who are on, including our board chair, Steve Balls, Chris Cox is another board member, Dave Larson's another board member. The board recently approved an investment in Silvus of $20 million, and we'll be doing some upgrading and updating for Silvus. Most of that money will go to a large operating room expansion project, some general updates in many parts of the hospital, expansion of other clinical services, and then some needed infrastructure updates, because things like our electrical systems, our plumbing systems, our heating, ventilating, and air conditioning systems, believe it or not, are approaching 50 years old, and they need to be replaced at Silva. So it'll take us 2.5 years to do that work of $20 million. There are some additional master plan campus upgrades we'd like to do that will be considered after that 2.5 years, but it's been quite a while since we've invested $20 million at Silvus. Next, I'd just give you an update about our cancer program. One of the things we did, it's almost 2 years ago. In December, it will be 2 years that we brought on 3 physicians who actually mostly were practicing in Illinois. We brought them on and they have become our Genesis cancer physicians. We added 1 additional physician. So now we have 4 physicians, and we have gone from very little cancer volume in treating cancer patients in the community to a very large cancer center. When we were doing some consulting on this before and had experts in from the outside, they told us if you're doing 2,000 new cancer cases per year, it's a pretty serious program, and we are approaching now 2,000 cancer cases per year that we are treating. The other thing I mentioned is our growth of Genesis Health Group employed physicians. We are almost at 380 or 370 providers. So that means both physicians and nurse practitioners. And the most recent group to join Genesis is on the phone. Dr. Lohmann actually is on the phone, and that's the DSG group, Davenport Surgical Group, and they joined Genesis in June of this year, and we're very happy to have them. We have some other exciting additions that are happening within Genesis, mainly in our cardiovascular surgery, vascular surgery, and thoracic surgery area. These are areas that have been underserved for some time within the community, and we're working very hard to expand that. And Joe Lohmiller just wrote a note to everybody, glad to be here, glad to be in the tent, as we call it. So now DSG is in the tent. I mentioned this last time, but I'll mention it again. One of the more exciting announcements that's happened at Genesis since I've been a part of Genesis, which is almost now 13 years, and that is we were recognized of the 350 healthcare systems in the country. There's over 5,000 hospitals in the country, but they conglomerate into 350 systems. Of the 350 systems in the country, based on quality outcome and cost outcome data, we ranked in the top 15 of all systems at about the 2nd percentile. So if you calculate that out, there's 7 systems that ranked higher than us, and we're very proud of that, and that's quite an accomplishment for Genesis Health System. If I think about what's gone well, particularly in the almost 7 months now of our COVID experience, 6.5+ months, the teamwork has been phenomenal. If I think about how our providers have come together to take care of business, both COVID business and a regular business, respond to very challenging circumstances, ramp down our business, and then ramp it up again. And all the provider involvement, physicians, nurses, and others, it's been truly extraordinary. The teamwork also to be innovative and make sure that we are treating COVID patients with the utmost quality of care. And 6.5% is a pretty low number. If you look at communities surrounding us, and even on the other side of the river, you'll see a mortality rate that's higher than that 6.75%. So both at Silvus and at GMC Davenport, we've done very well in being innovative and treating COVID patients. Another thing is we've adopted new techniques and new procedures and new ways of doing business with tremendous speed. And one of the things that's happening, we're going to hear an update on Thursday to the board about this, is everything that's happening in telemedicine. And we've seen tremendous growth in our telemedicine business, in the number of telemedicine visits that physicians are seeing, because it's just simply, in many cases, more convenient for patients. And so telemedicine is a big part of our business. It grew up to be all of GHG, and they see about 500,000 people a year, 500,000 individual physician visits. It grew to be about 25% of all their visits. It's back down to about 5 or so percent, it'll grow up to 10%. We think we'll stabilize at 10% of all of our clinic business. The last thing I would say that's gone very, very well, and it's unique in relationship to systems our size, is our ability to do COVID-19 testing. I think I talked about this last time, but in December in the United States, there was nobody that was doing any COVID-19 testing. To move from having no tests to being 9 or so months in and doing more than 1 million tests a day in all of the country is a pretty incredible feat. And we have 3 internal machines. We're moving to a 4th machine.
Oh, that's okay, no problem.
Somebody might want to go on mute, by the way. We're moving to a 4th COVID testing machine. And we've done as many as 400 tests a day. And the reason we like doing these tests internally and that we value our ability to do the testing is we get the results much quicker. And there's some hospitals, and I'm not going to name anybody, that was one hospital that one of our employees had to have surgery at for various reasons. It was in our region, and they were not going to be able to get their results back for 6 days, and we can get our results back essentially in 1 day. So COVID testing is a pretty incredible thing that's happened well. What about the challenges, the things that are difficult for us in our experience right now? And one is morale. And I talked recently, in fact, I'm going to go to their staff meeting, to our medical pulmonary unit upstairs at GMC Davenport East. And that's the unit that cares for all the COVID patients. They're our COVID unit. Some days they have as many as 20, some days as few as maybe 5. It's difficult to be on that unit and be a nurse because they have to dress up, they have universal precautions, they have COVID precautions. It's a marathon for them. And knowing that they're 6 to 9 months away from really being back to quote unquote normal, if you will, that's a challenge. And Dr. Kopp's going to talk about that more, but you know, the whole mental aspect of caring for COVID and having it be a marathon rather than a sprint is a very difficult thing. The other concern and challenge that we have is we've seen a lot of variability in the positive symptomatic tests that we see on a daily basis. It was just last week and the week before that we were spiking at around 15%, and we get very concerned when that happens. And so we're very concerned that certain pockets have outbreaks. We've seen correctional facilities have outbreaks, nursing homes have outbreaks. And this can go sour very quickly, and it's happened in pockets. It's not happened everywhere, but we're very concerned that we could see a significant increase in the number of COVID patients. It just so happens right now we have, I think it's 6 patients from one of the correctional facilities in Illinois at our Silvis campus. And you know, that's a bit of an outbreak at that specific correctional facility. Next concern, from time to time, we have blood supply problems, and particularly Rh negative blood supply issues. And one of the things I'd encourage all of you to think about, if you can donate blood, is to donate, because every 5 to 6 weeks, blood has to be replaced. It doesn't last forever. And we have surgeries that we do every day that need blood. And there's a diminished number of people giving blood because of just less people being out and about and responding to the call to give blood. And so blood supply has been a problem from the beginning of this and has started to impact us. And we have had to cancel some surgeries because of lack of blood. Lastly, we're not in the business to make money, but like the sisters taught me many years ago when I ran St. Joseph's Hospital, a Catholic hospital in downtown St. Paul, Minnesota, no margin, no mission. So the financial impact of COVID-19 has been really challenging for us. The loss in revenue, while we were in our dip period when we stopped electives, was $36 million. Plus it cost us $7 million in unique COVID response expenses. So that's essentially then $43 million. We received federal support of the tune of about $20 million. So that's a deficit of $23 million just from our COVID experience. Our experience is not uncommon in relationship to that, but it's pretty sizable given the size of Genesis. Now, for that and other reasons, challenging budgets have to be put together. And it was just last week on Wednesday and Thursday that we had to announce, unfortunately, a cost reduction. We made some temporary adjustments. Some of those are for benefits, some permanent adjustments, and essentially reduced our expenses by about 4%. So that's a difficult thing within Genesis. It was about a $30 million reduction because we're about a $700 million company. So with that, that's the overview, and I'd be happy to answer any questions later after Dr. Kopp finishes. We're going to turn it over now to Dr. Kopp, who's going to speak for, again, about 10 minutes on mental health topics and the pandemic. So Dr. Steve Kopp, take it away, and let me just introduce you briefly. Dr. Kopp has been the leader of Genesis Psych Associates for now a number of years. If I had to guess, you can say Dr. Kopp, but I think it's been at least 8, maybe 6 to 8 years. Does an absolutely fantastic job as both a leader as well as a clinician. We're extremely lucky to have him, and we have the largest group of psychiatric, associate providers within this community, and he can share with you the number. And we're just very grateful for these people and all they do to help our community maintain mental health. And so with that, let me turn it over to Dr. Kopp.
Well, thank you, Doug. I appreciate all of your support in behavioral health over these years. In the last couple of days, as we've been talking about our financial mitigation strategies regarding the pandemic, I have been especially aware of the fact that your fiscal conservativeness and wiseness over the years has put us in a place where we can buffer this. The numbers that we talk about, that we lost in the last 6 months just boggle my mind. And so again, thank you for your leadership through this. I also want to take a moment to thank the foundation because your support has also been instrumental in getting some things that we have only dreamed of done. For the longest of time, we've had a mission to provide care in places where we knew there were some easy wins that made major differences in people's lives. And so your assistance, for example, in the Heart Institute here recently has made, that happen. And thank you so much for that. Just to give you a little background on that, about 40% of individuals who have a cardiac event experience some kind of mental disorder after it, whether that is, depression, anxiety, or PTSD. And that is a huge factor. If there's, for example, depression in a case comorbid with a cardiac condition, that raises the mortality rate by 17%. Just having those two things interacting with each other. And so again, instead of a mortality rate of like 3% over the next 6 months after that event, again, it jumps to 17%. And that's a significant difference that we can make. These are smart moves by the health system to provide compassionate quality care to individuals who are in need right away that can't afford to be sitting in a line waiting for their care. And so again, you made that happen. It means the world to me. Thank you for enabling us to do that. So the pandemic and behavioral health, it's no secret that these two are not going to run into each other very well. I mean, they're just not going to play well together. It's going to be a harsh reality for our country. The mental health system was already taxed. About 1 in 5 Americans suffer from a mental illness. If we're talking about serious mental illnesses here in Iowa, that's about 150,000 individuals. And so again, this is a lot of care that needs to be done. And we have major shortages in the providers in our state and in our nation. In fact, that has come to be known as called the silent shortage. For example, if you look at psychiatric services, the AMA says that it takes about 40,000 psychiatrists to do the bare minimum job for the United States mental health system. And we've got 200,000 psychiatrists in play right now. We're 50% of what we need in the mass of psychiatrists to get the job done. I'm proud here, again, with Doug's support, with the foundation support, with the board support, You know, we saw that, we acknowledged that years ago, and in the last 3 to 5 years, we have tripled our psychiatric services through outpatient Genesis Psychology Associates. And so again, I feel good about that move, and I think we're doing our best to provide services here in the area. You know, another area is, again, you know, our access points has been a troubling thing across the United States. These are not Quad City problems. These are not Iowa problems. These are national problems in behavioral health. And so one of the things that we've been doing is trying to build a better system, not just more providers, but better situated providers. For example, one of the things that the behavioral health system across the United States has been leaning on is our primary care physicians. Our primary care physicians have been the front line of mental health for too long. You know, this often takes that time away from them to provide care to other areas, or often, you know, just gets neglected because individuals don't feel like mental health specialists. And so one of the things that we've been doing and working before the pandemic was to put integrated care into play in our health plexes. And so again, before about 3 years ago, when we were looking at these access issues and trying to determine where we were going to go, we have tripled that too. So I feel really good about we're getting more integrated care and allowing those providers that are on the front lines there, those primary care physicians, to have behavioral health supports. And so again, we've had some major wins here over the last 3 to 5 years. But things are going to get hard. Things are going to get very hard. You know, we overcame stigma only to run into an access problem. That's the harsh reality of behavioral health, is that, you know, even if Doug said, you know, hey, Steve, double what we've got tomorrow, the reality is I wouldn't be able to find the providers. Or if I did find the providers would be providers that I would not believe could carry Genesis mission. So we have to, you know, continually look for providers, recruit for providers, and grow as fast as we can, but in a quality way. And, you know, the pandemic, ultimately, I think probably the harshest idea of, if you want to see what the pandemic is going to do to behavioral health, you know, one of the startling statistics that's been thrown around quite a bit now is everyone knows that we have about 47,000 suicides a year. But it looks like we are going to possibly have around 78,000 additional suicides secondary to the pandemic, right? And our system is not ready to care for that. Our system is not equipped to be able to handle that much mental health crisis. And so again, we're trying to pivot and work faster, more efficiently, and get people more proactively cared for to prevent a lot of that aftermath. In fact, that's been talked about as in the media as the suicide tsunami of the pandemic. And so we will hope that that doesn't come true, but the number of bankruptcies and the number of divorces that we kind of expect that will come from this will certainly increase those statistics in a major way. I think we're looking at, you know, one of the things that we're going to be looking at here on October 1st, right, is the airlines alone could be laying off tens of thousands of people. And you know, just the hit that does on every family, right? When mom or dad now are not working and it's hard to pay the bills. So again, that's going to be on our front lines. That's going to be the kind of individuals that we are trying to support. I'd like to brag about my providers for a minute, because again, a lot of times they don't get the credit for how we responded. But you know, when we encountered the pandemic pretty much shut us down. The reality was, for safety, we didn't know what we were doing regarding what would and wouldn't be safe. So a lot of people just weren't coming in. And so what we did was we pivoted immediately, and all my providers were making phone calls to their patients on a daily basis. In fact, some of my providers were doing as many as 30 calls a day, just checking on people, just saying, how you doing? Has anything happened? Are you doing okay? I know your session isn't for a couple of weeks, but we wanted to make sure you're okay. And we got a lot of mixed comments. It was kind of interesting, in fact, from a mental health standpoint. Some people were, just panicked. I mean, some people were afraid they were going to lose their job, could lose their house, they were living bill to bill. And so again, we heard a lot of anxiety and fear. Now, on the other side, it was kind of interesting is that a lot of our obsessive clients, these individuals who are dealing with compulsive disorders and worry about, germs, were feeling very validated. They were loving this pandemic, that everyone had now caught up to them and was wearing masks and was cleaning. And so again, it was kind of an interesting mix of what we were experiencing on that first month's hit. We quickly pivoted with running fiber optics through the office, getting iPads for everybody. And I'm proud to say that we are, up and running full telehealth, and we're up and running very quickly in telehealth. And we continue to be that way. I'll be honest with you, I wasn't really sure about this telehealth thing when we first started it. You lose a lot of the interaction when you're not alone with someone and you're not in the room. In fact, one of the things that we talk about is you got to smell your client, right? I have seen many a geriatric woman who have come in here perfectly dressed but smells like pee, right? And so again, it was going to be an interesting play of whether or not this telehealth thing would work. And I got to say, it's working really well. In fact, many of my clients who have pushed to say, I don't think I like this. I'm gonna come in, have been rudely awakened to see Steve in a mask and in goggles, where then you don't get any of the facial expressions that are so important to psychotherapy. And so again, we're shooting with a really high percentage of individuals who are still doing telehealth, and it's working quite well. Our next challenge from a behavioral standpoint in that area, though, will be whether or not they'll continue to pay us. The reality is that we're now seeing the beginning of insurance companies and carriers are starting to stop paying for phone visits. One of the things that happens here is that the telehealth system isn't perfect, and so many individuals, for whatever reason, aren't able to connect. And there are individuals, that we just really quickly have to pivot then to a phone call. And so we are seeing the early denials, which is the first kind of step toward companies not paying us for telehealth or telephonic sessions. And again, we'll be working that out. We're working that out every day and monitoring that closely. But again, I think if there's any way that we can be legislating and be pushing, is to say that we need to keep those access points open, because we're not even close to over this yet. Again, the big thing that I want to say is that there's a lot going on in behavioral health. In fact, one of the things that I would say to all of you is that it's such an interesting collision of a very weird dynamic. So on one side of this equation, we are extremely overstimulated. The socioeconomics, the political aspects of this, the fear of COVID, all of it has us very amped up, and so that overstimulated side of our brain that is worrying and fretting is problematic. And obviously, one of the great answers that we can have to that is we need to be checking out of our media a little bit more and, shutting off social media and doing some things that are more pro-social for us. But on the second side, what's very interesting in behavioral health right now is that people are not only overstimulated on one side, but they're understimulated on the other. And what I refer to there is that we usually have these positive buffers for our mental health. We get out, we socialize, we have hobbies. For example, one of my favorite hobbies is the gym. That's one of the ways that keeps me sane, in this very busy lifestyle that we live as professionals. And I got to tell you, I haven't been in a gym for 6 months. My waistline's showing it. I can promise you. There's proof positive right here if you saw the other half. But the truth is that, again, these positive insulators, like getting together with our friends, seeing our family, going out and exercising at gyms, having dinner with people, those things have plummeted, and so our ratios are all screwed up. We have overstimulation on one side and no buffer on the other. And so again, one of the things that we're trying to work on very hard with our patients is getting them back engaged in the world, keeping them active through this, because if not, again, those fallout factors are going to be huge. So again, that's the major message that I have for you today. And I want to give you more time to ask Doug and I questions, because I know each time I talk to Doug, we have entertaining conversations. And so Instead of talking at you, I'd love for you to throw out questions that you have for either one of us. And if you don't have questions, Doug and I will banter and have some fun ourselves, I think.
Yeah. So Missy, do you want to kind of facilitate the questions here?
Yeah, I would love to. Dr. Kopp, I do want to start just by reverting back to what you said about 78,000 additional suicides.
Yeah.
And if I could drill down a little bit, are you thinking those are going to happen with any certain age demographic, for example? Would it be the seniors that have been tremendously isolated? Are we worried about young people and the stresses of trying to go to school and be normal and have social interactions, or is it across the board?
Well, a lot of it is across the board. We're assuming that it's going to be hitting certain areas harder that are just consistent with what was trending already. Like, for example, one of the things that we've been trending for a long time is our young female teens. Female teens are of concern for us and have been for a long time. I would say that one of the areas that we'll be seeing it is our alternative lifestyles. Those individuals, again, tend to be affected by socioeconomics in big ways because of the type of jobs that they hold and their position in society. And then, like you said, we're going to have a lot of individuals who, because of bankruptcies, so those middle age and upper age, we're going to see a lot in those areas. So it's pretty across the board. No one's buffered from this, right? I mean, the reality is that even if we just look at the grieving alone, right? Every one of those people, even the 18 in our community, that's not just 18 people who were lost. That's 18 families that lost, right? That's a community of people who loved those 18 people that now have to grieve that. And, grief generally is spread out, right? It's just, we all have this demographic. We've all been there, we've all been part of this age. We're like, man, this is a rough year, right? But this is going to be a really rough year for everyone. I've had clients who, already have lost two or three family members across the nation. And again, that's harsh. And this isn't just 18 losses. Because, the reality is we just have normal mortality that's going on, right? We still have car accidents. We still have diseases that are killing. So when we say 18 people in the Quad Cities or 200,000 in our nation, that's not the total of our losses. That's not the total of grief in America. It's going to be hard. It's going to be hard. It's a great question, Missy.
Thank you. Steve Balls, the president or chair of the Genesis Health System Board, weighed in and said in past years, those in crisis with mental health issues had a hard time getting a timely appointment with the appropriate mental health professional. Is this still the case? And I think you touched on a little bit of access earlier, but can you answer Steve's question?
Yeah, Steve's very well informed of these issues, and I knew Steve would ask a good, hard-hitting question. Thank you, Steve. It's a great question. So what we've tried to do is balance it. It still is the reality. I'm not going to deny that there are wait lines. We do a pretty good job of working people in earlier and quicker. But one of the things that we've worked on very hard is not just trying to increase the number of lines that we have, but where the lines are at. And so again, we push things to the front where again, our behavioral health integrated therapists can carry those individuals for a bit of time while they're in crisis or during a crisis before we can get them to a therapist. And that's really, really important because that's where we've lost a lot of people. That's where the crack was, right? Is that getting from your primary care physician to a treatment professional was too long a wait, way too long a wait. And so now if you're connected with a primary care physician, we're going to use those behavioral health integrated therapists, to reduce that time. And not only reduce that time, but to be able to be a resource for who are the providers in the area. And that isn't, we are committed to mission on this. We want to be capturing as many of those people as we can. But if we cannot, quality of care is more important. And so we make referrals to where we have to get those people the help that they need. And again, we've increased our efficiency in getting people from those primary care physicians to psychology associates because those individuals can triage that on the front side and can determine who's the provider that needs to be seen in this, and then can call in those favors to our office. So it's a great question, Steve. Did I answer that fully?
Yeah, thank you. Much appreciated.
Yeah, yeah.
Steve, Dr. Kopp, so a lot of us are parents. Some people are fortunate to be grandparents. And yeah, no desire on my part right at the moment, of course. Yeah.
You're not old enough for that, Missy. Come on.
Oh, God love you. See, you say all the right things. That's why you're on this call. Anyway, Craig Cooper, who is a grandparent, and he said
He is
COVID-19
old enough for that.
COVID-19 is a lot for kids and grandkids to handle. What can we do for them?
Yeah, it's so much. It's so much for our kids to handle because, you know, conceptualizing an invisible enemy, an invisible threat to a kid is, you know, this is the monster under the bed, right? You know, this is the thing that they can't see. And so their imaginations run wild. And so one of the things that we need to do to talk to our kids is be very concrete with them about what germs are and what they can do and what we want them and need them to do to protect themselves. But the other thing is that we need to be very careful about what we expose them to. One of the things that we're doing is we're leaving televisions on in the background and watching them ourselves, but you know, our kids are hearing that tone. We're talking on the telephones in ways that, again, are talking about how bad it is and how awful things are going to be. And our kids are hearing our tones. You see, young kids, they're not intelligent enough at this point to analyze situations, so they use intuition to determine their realities. They literally feel us for security. And so one of the things that we need to do is do a better job for our children to convey security and normalcy. Another thing that I would say for a kid is you've got to establish routine. Stay in bedtimes and, you know, have family meals. And do things, you know, have, even if it has to be, video contact regularly with grandma and grandpa, because breaking these relational chains and, you know, breaking these routines undermines a child's locus of control. And that's the last thing that we want to do during these kind of periods. Keep as much normal as you can.
I think that works for adults too. We talk about kids. You know, it's often been said that, well, kids are resilient. They'll get through this. So I don't know if you want to comment on the resiliency of youth as opposed to the resiliency of the rest of us, but.
Well, there's decent arguments that they may be more resilient than we are at times, you know, and the fact that they're so adaptive, right? But, you know, as much as they are very resilient, they're also very impressionable. And so it's kind of a mixed bag. Let's be honest, age and wisdom kind of, we hopefully have learned what things we're going to sweat, and we don't sweat the small stuff, but children will. And so again, as much as they're resilient and they do quite well, the reality is they're very impressionable. And so we got to be very careful of what we're exposing to them when it comes to their locus of control. Again, kids can get really spooked. And you know, I think that while we're on this subject, I mean, we want to be watching for those areas where they're decompensating, right? You know, where they're having nightmares, their academic performance is failing, you know, they're disengaging from their peers, they're having moments of meltdowns and irritability, they're having trouble sleeping. I mean, these are kind of things that if you see these things, you know, weigh in with a professional or their primary care physician. A lot of times some small behavioral modifications can make major differences in that kid's life.
Dr. Kopp, how are you helping with individuals who keep yearning for normal when there's a very good chance that we're not going to see normal as we know it? So how do you give people hope, and how do you keep them feeling positive about the future when everybody wants something that generally they may never get? Yeah,
it's been a tough, you know, there's no one blanket answer that I can say to that, but because it has been a tough issue that we're dealing with. You know, some of those individuals are coming from a more existential standpoint. Some of them are just, it's a very practical thing that's happening in their life. But what I would say is that we focus a lot on a behavioral approach to this, taking and moving into an active phase. Because one of the things that happens during these kind of things, when we get into crises, it's easy for the population to become passive, right? One of the things, I don't know about you guys, but you know, I think the world's trying to run out of Netflix, right? You know, we're trying to get to the end of Netflix and have completed to check all the boxes. And this is, this is a problem. TV is not a problem, but what's a problem is excessive amounts of anything create a diminished return. And so, you know, whether you're watching your favorite programming for 2 hours or you watched it for 4 hours, you probably only got about an hour and a half of, you know, fulfillment or enjoyment out of that. And then you went into complete passivity. And so one of the things that we're doing, Missy, is encouraging people to get into an active role. One of the things that's fun for me is I've been suggesting that a lot of people get back to some of those hobbies that they've wanted to do, right? You know, some of those things that they've always wanted to do. What did you always want to do? I tell you, I'm always wanting to read more. I'm like, you know, if I only had time, I'd read more. And I was really mad at myself the other day when I realized I haven't really gotten any reading done. Now that's because Doug works us all very hard, and and then Missy always wants me to do these, you know, these talks. But you know, it's been fun. I've been taking this home and, you know, talking that at the table to my family and my wife. And I was so proud. Many of you know Laura, you know, Laura Kopp from, you know, active in the boards, and she ordered a paint by number, you know, and so she's doing a masterpiece right now. I mean, it's beautiful. And I keep telling her I'm going to hang it up, you know, but that's one of the things that we're doing is we're really encouraging people to do things, not just sit passively through this.
I have one final question, and this will come from Mark Bodden. If someone finds themselves in a crisis with a loved one, is there some place to go or some place to call for emergency help? I know where to go with a broken arm. What do I do in a mental health crisis?
That's a great question, Mark. Thank you for asking it. You know, so a lot of it depends on how much of a crisis. We're talking about a suicidal situation, which is, you know, that's as crisis as we get. The bottom line is that we want those to go into the ERs, because again, we want to get those access points immediately. We want to reduce risk immediately, right? You know, many a times one of the problems of like a suicidal individual is that these individuals will, you know, will feign that they're better. I don't know if you guys know this, but actually one of the things that we worry most about in suicide is that a rapid improvement can actually be a sign that the individual has made the decision that they're going to end their life. And the moment you do that, all the stress and pressure and anguish that you're going through is immediately alleviated because you're done, right? You've made a decision. You know what you're going to do. And so those individuals very often will start telling everyone they're fine because they just want an opportunity to fulfill their plan. And so again, in those moments, when we're talking about suicide, we access the fastest points ever, and that's again going to be through an ER. And let some of our great docs at the inpatient unit be involved in that very quickly. If we're talking about an individual that, you know, we're worried about their level of functioning and we're saying like there's an acute mental health crisis happening, again, one of the fastest places is to get assessed is through their primary care physicians, because the primary care physicians know them, right? You know, they already have a history with them and they can assess things and determine who's going to be the right provider. If they're involved with, again, a Genesis doc and in one of our health plexes, again, that's going to probably be moved over to one of our behavioral health integrated therapists who's going to, again, help triage and determine where is the best access point for that individual. Because the last thing that we want to do is to finally get them engaged in treatment and then have them find out that, you know what, this isn't even the provider you should be seeing. You know, this provider's a specialist in trauma and abuse, and, you know, you're having an anxiety disorder. And so again, or this provider is a child specialist, and what you really need is that trauma specialist. So again, primary care physicians are going to be a great access point for individuals. You know, and I'd like to say that there's a lot of access points in our system. That isn't always true. You know, we had a siloed system for a long time. I mean, the reality is that there was a broken aspect of behavioral health is off in our corner, and we worked so hard that no one knew who we were because we were just behind closed doors all day. And that doesn't change much. As you can see, they didn't let me out. You know, I'm still there. But but behavioral health is far more on our radar as a medical community than it has been ever. I mean, I don't know about you on that, Doug, if you'd agree. You know, I think, you know, we've come a long way in the last 5 to 10 years. And so what I'd like to hope is to say that, you know, all of Genesis is now a better access point than they've ever been. Now, Mark, what I'd say is every person who has a mental health disorder, you know, needs advocates. If people aren't getting the answers that they need, advocate that they keep moving in the system. And if nothing else, please call our office, right? You know,
Dr. Kopp, can you give us that number?
Yeah, I'm definitely, I'll definitely give you the number. So my number here is 563-355-2577. That's 355-2577.
I appreciate.
I'm always worried about giving my, you know, am I the only one that worries about giving their personal cell in these kind of calls? You know, that you just, that you accidentally go with the wrong number?
Well, it'd be a great thing to have, a great tool to have. And I want to thank you for being on the call. Unfortunately, we've run out of time. I want to thank all of you for participating today, Doug, Dr. Kopp. This, again, is part of the series. If you want to mark your calendars, November 18th at 4 p.m., we'll have another Doug and a Doc, and this time it will be Dr. Kurt Anderson, and he's going to talk a little bit about our aging population. And Dr. Anderson is a wonderful leader here at Genesis, and I know you'll enjoy hearing from him. If you have any other ideas about physicians that you'd like to hear from, please shoot me a note. Just call my office or send me an email. We'll make sure that we get that arranged. And have a safe rest of your day. Thanks so much.
Thank you, everyone, for joining.
Thanks, everyone.